Kendra, and I'm here with Kenael Segal. She is a doctor of physical therapy and a specialist in pelvic floor and women's health. And I'm here to ask her a lot of questions that you guys have. So one of the main questions that we get asked is, what is pelvic floor physical therapy and why is it so important? So I'm going to have Kenael fill us in on that.
So pelvic floor physical therapy is a different kind of therapy. So it involves an internal and external exam, and the main focus is looking not just at the muscles, but we're looking at the muscles, we're looking at the skin, we're looking at the joints, the bones, we're looking at the nerves, so we're looking at the entire pelvic girdle, and that's usually the area around your hips that people look at.
Mm-hmm.
So there's a lot of things that can happen during a pelvic floor physical therapy examination.
Mm-hmm.
So as I said, it includes a lot of different things. So we always look at the muscles, bones, the alignment. We're looking at how the body moves, how it doesn't move, are there compensations, are there substitutions happening in the body, and why are those things happening? And then we try to use all of that to determine why an individual is having the problems that they're coming with.
Mm-hmm. Mm-hmm. So a global perspective kind of comes down to looking at the pelvic floor and how it relates to the rest of the body.
Correct, because the pelvic girdle, it connects every part of the body to another part of the body.
Mm-hmm.
You know, it's your trunk. This is where your center is, and it connects your arms, your legs, and it allows you to be stabilized. So if there's an issue there, it can result in issues elsewhere down the chain.
Right, right. So why is pelvic floor PT so important?
I think it's important for everyone to know what it is, especially women prenatally and postpartum, because during pregnancy and the birth experience, there's a lot of trauma that can happen to the pelvic floor. So during pregnancy, the baby is in the uterus, and the uterus is supported by the pelvic floor muscles.
Mm-hmm.
And there's a lot of heavy lifting that the muscles have to do. So over time, they become very weak. And there's a lot of other things that can happen as well, but that's just one of the main or easiest ways to understand it. And then even the birth process itself, remember those muscles have to lengthen and give way for the baby to come out if there's going to be a vaginal delivery. And oftentimes those muscles can have a lot of damage as well, just from the act of the stretching
Mm-hmm.
and the nerves as well.
Yeah, all right. So what would be a signal for someone to come and see you to make an appointment with you?
So there are a few things that I treat, and a few of them, just to categorize them, I guess, best way. So if someone's having bowel or bladder issues, incontinence, they're unable to control their urine, constipation, they're having trouble going, or they're straining, or they have hemorrhoids as a result. So anything bowel or bladder related.
So
even
things like jumping and feeling like a little pee,
a little
or
leaking,
like sneeze,
exactly.
Okay, yeah.
Or even the key in the door syndrome. This is where you're driving home from work and all of a sudden you have to go now. So that's even something that we treat, because that can be a behavioral thing that we just need to change and work on.
Mm-hmm.
And oftentimes some people are drinking too much water or not enough water. So it's not just dealing with, okay, you just need to strengthen your muscles or just lengthen your muscles. Sometimes it's how much water are you drinking, or how much are you not drinking. So a lot of times there's a nutritional component to it as well.
Awesome. I love. Can you tell me a little bit about what a PT, pelvic floor PT appointment would be like? What would a woman expect?
Sure. So as I said before, there's internal and external. So we're looking at what the body is doing and what it's not doing. But initially, the first visit, you come in, I listen to your story. And that's just what brought you here today. What is different today than before your symptoms started? And oftentimes it's the first time some people are able to express what's been going on, because it's such an intimate area that I work with. A lot of people, they have never mentioned these things to someone else before, not even their doctors, because they feel a little embarrassed to talk to their doctors about it, or even their girlfriends or their parents or family or anyone. So a lot of times it's a relief for women to just be able to explain fully what they've been experiencing. So that's just a story part of it. And then I use that story to determine, what am I going to look at? What am I going to assess? Am I going to assess the muscles? Am I going to look at more the joints, the bones? Am I going to focus on one specific area of the body, or look at multiple different areas? We can't look at everything, so it's nice to have a story behind it, so I know where to focus. And then I always ask questions too to help tailor that a little bit more. And then after the assessment, we come up with a plan. And the plan is just, where are you now, where were you in the past, and where would you like to be in the future? And then we also take into consideration what's going on now. So most of the women I treat have children, so a part of our plan is usually exercise, a home exercise program, and women don't really have the time to go home and exercise for a long time. So we try to use the living situation to come up with easy ways of throwing in some exercises here and there, because it has to work with your lifestyle. And if it doesn't, then you're not going to do it, and then you're not going to get better.
Right. Yeah, we see the same thing with exercise. Postpartum exercise. It's if it doesn't fit in easily, it's the first thing to go.
Exactly.
So it's important,
and it's so important, and it shouldn't. I mean, I try to stress and encourage that this isn't something that you're doing for this short period of time and then you're never doing it again. It's these exercises and education that you learn are things that you take with you, for the future, really. Because the whole point is, I don't want you coming back, as much as I like you, but I don't want you coming back for treatment over and over and over again. So I teach you what it is that you need to learn so that you can use that in your daily life going forward. So hopefully try to minimize your chances of having to come back.
Yeah, that's great. So the education is really there.
There's a big piece in education, because there's not, where do you learn about your pelvic floor?
Right.
Exactly. So there's a lot of education on what is your pelvic floor, how does it work, what should it do, what should it not be doing, and then how to care and manage.
Yeah.
And it helps that our sessions are usually 45 minutes to an hour. The evals could be even longer, an hour to hour and a half. So there's a lot of time for us to talk, and there's a lot of time for me to see what's going on and what's not going on, and for us to develop a plan. So there's a good chance that you'll feel comfortable, because I hope to have everyone feel really comfortable so that they share what's going on, because once I know what's going on, then I can better help and serve you.
Right. Nice. That's great. Can you go into detail a little bit more about the internal exam part? Because I think that's one part of the pelvic floor PT that might be a little
Scary.
Yeah.
Absolutely. So it's not like a gynecological exam. I'm looking at the muscles and how they work. I'm looking at the bones. So a lot of what I do is actually external. The internal part is not as intense as people think it is. So a few things that I check is, where are your muscles? Are they responding the way they should? Meaning, are they feeling nice and relaxed when you intend to relax them, or are they feeling guarded and spasmed or short and painful and tender? No muscle should be tender. Every muscle should be able to shorten, and every muscle should be able to relax, and it should also be able to lengthen. So those are some things that I check. I don't use any tools. My only tool are my fingers, and they're very short and stubby, so it's really not that bad. And then I'm checking things like your breathing. Are you breathing correctly? And is that tying into the movement, the natural movement of your pelvic floor muscles? And I check your strength. How strong are your muscles? How weak are your muscles? Do they have endurance? Can you hold a contraction for a long time? And these are things that your body and your muscles would do throughout the day. So your muscle has to be strong enough so that you can hold urine when you intend to. And they have to have endurance so that you can go for a run without leaking.
Right. Yeah, that's great. Right. Well, thank you so much for being here and for sharing, this amazing information. I know you're going to help a lot of women, hook up with a pelvic floor PT. So see your PT, see your pelvic floor PT.